Macon Volunteer Clinic's mission is to provide free primary medical care and dental care, as well as non-narcotic medication assistance to working uninsured adult Bibb County residents who live at or below 200% of the federal poverty level. Basically, in Bibb County, 25% of adults are uninsured, and over 48% of Bibb County residents live at or below 200% of the federal poverty level. So the need is staggering in Bibb County. It's really sad when you've got someone who's deciding between food, shelter, or their health. And that's where we come in. We can contribute in a positive way. Initially, Peyton Anderson provided startup funding for the clinic. It was an idea in 2002 of Chapin Henley's to start a free clinic for working uninsured adults in Bibb County. And Juanita Jordan really saw the value of having this clinic in our community and started with seed money. And then from there, as we went from a 2-day clinic, which only offered medical appointments, she also saw the value of us offering dental and provided further support from there. And when you're dealing with things like hypertension or cardiac disease or diabetes, really the most immediate impact, positive impact you can have on someone's health is to have good oral health. So she saw that value, and we started offering dental. And from there, we've had additional support with diabetes education and diabetic testing supplies for our patients. Now we've even expanded it from just the 2-day clinic. Now we operate 4.5 days a week, plus every 6th Saturday through a partnership with Mercer University School of Medicine. And we're offering primary medical care, dental care. We've just expanded to offer restorative services. So now our patients, besides cleaning and extractions, they also have fillings. And then the eye clinics, we do GYN services, dermatology, neurology, cardiac care, diagnostics, labs, x-rays, cancer screenings. We have a full breast health services program, nutrition counseling, mental health counseling, and now free outpatient surgery for our patients. What happens is we recruit physicians and nurses and dentists and eye doctors and a variety of medical professionals, whether they serve on-site or off-site. And we really collaborate with all of these medical and dental providers in our community. And we create an outreach through all of these providers to provide even greater services for our patients. If someone would like to volunteer, it's just a matter of either coming in or visiting our website and signing up to do so. We have everything from administrative volunteers all the way through surgeons. And for our medical volunteers or licensed volunteers, they actually receive sovereign immunity from the state through the Georgia Volunteer Healthcare Program for providing services for free to our patients. In the grand scheme of things, a physically healthy community creates an economically healthy community. If you've got a clinic like Macon Volunteer Clinic, you think, well, the patient's going to be healthier. Well, it's not just that patient. That patient is at work more frequently because their acute and chronic illnesses are managed. So you've got a happy employer, but the patient's family also benefits because the patient is at work more frequently, so there's financial stability for the family. And then also the emergency rooms benefit because our patients aren't in the emergency room. So when you have a patient base between 750 and 1,000 patients, you can easily see what that impact is on the community. Last year in 2015, we provided 6,277 patient visits, and the retail of these one-on-one patient encounters, as well as the diagnostic services that we've provided, is over $3 million. And our budget is way less than that. So for every dollar that we get at the clinic, we're actually turning it into $5.44 in the community and creating over a $3 million impact in the community. Outside of the big economic impact that we've made in the community, it really comes down to our patients' health and their well-being. And Peyton Anderson Foundation has allowed us to make a positive health impact in our patients' lives and patients like Gayle.
I had lost my husband back in 2008. He had passed away from diabetes. He had lost both of his legs. He was on dialysis 3 days a week. And so I had seen what it had done to him, and, it was a scary feeling, because it makes you wonder, what am I going to do? But anyhow, like I say, through the grace of God, I found out about the clinic. And, I felt like, it saved my life. I mean, because you can't ignore diabetes. So I think I've lost like a total of 65 pounds. And once you do that, that helps your diabetes and it gets it under control. And the clinic's been real good about helping me with that. And I have high blood pressure too. And, me losing the weight, that has helped. And, just any problem I have, they've been able to do whatever I needed done. There's just no words for me to tell you how professional they are. Usually you hate going to the doctor. I actually enjoy going and seeing everybody. Anytime I see anybody, that I know that doesn't have insurance and I know they're working, I encourage them, that this is where they need to go. Because I know with me, before I went to the clinic, I didn't even go to the hospital. I can't afford to go to the emergency room. Because that's still not free. I just sat there and suffered through it till I found out about the clinic. Eye care, you don't have to worry about not having the money. We go right there to the clinic. The dental care, everything's all right there. You're not running all over town. You can go right there and know that everything's going to be taken care of. It's not like going to the hospital where everybody's in a hurry. It's impersonal. At the clinic, everybody's got a smile on their face. It's just a nice, friendly atmosphere, like a comfort zone. I know if I get, let's just say the flu, I know I've got a place to go to, and, I don't mean to take things for granted, but, it's just so nice there and everybody treats you so well. I just don't, think, okay, I'm sick, I just got to call the clinic and, they'll come in and they'll take care of me.